Hello, my name is Dr. Michael Wald, and welcome to this presentation, which I've entitled No Shit, Fecal Transplants Can Save Lives. And forgive me in advance if I let a couple of bad jokes get through this fairly serious conversation, but this is a very serious topic. Fecal transplants might actually save lives in some very complex medical conditions. To begin with, my name is Dr. Michael Wald, otherwise known as the Blood Detective. I am a doctor of chiropractic. I have an MD degree, but I am not licensed to practice medicine. I just did medical school for the information and practice holistic healthcare. I'm a board-certified nutritionist, sports nutritionist, and dietitian. I also provide acupuncture and life coaching, and I combine those different skills depending on a patient's needs. So we'll be discussing what a fecal transplant is, where you get them, what labs are involved, what other nutrition you consider, and of course, most importantly, who are the proper people to consider a fecal transplant. So I'll begin with a very important disclaimer that the information I'm about to present to you is for your educational purposes only. It is not meant as a substitute for sound medical and health advice. So the gut is a very complex system, and sometimes probiotics are just not enough to get it in shape. There are conditions that are very costly in terms of quality of life and length of life, which seem to respond to fecal transplants. I think that my first article, which appeared in a nursing magazine on fecal transplantation and the procedure, can be found on my website at drmichaelwald.com. Just search the search bar for fecal transplants and you should get quite a lot of information. And there is some new information that I'm going to include in this very comprehensive but fairly short and practical presentation. So to begin with, what is a fecal transplant? So the full term is Fecal Microbiota Transplantation, abbreviated in short, FMT. And I'll be saying FMT throughout this conversation. And when I say that, we're talking about the fecal transplant. So fecal microbiota transplantation, commonly known as a fecal transplant, involves transferring stool, that's right, stool, from a healthy donor into a person's gastrointestinal tract. The procedure aims to restore a balanced gut microbiome, which can be disrupted due to a variety of factors. So what is so special about stool that makes it important for a variety of particularly horrific health conditions? These are some of the reasons. There's a diverse community of beneficial bacteria, particularly Bacteroidetes and Firmicutes, a little difficult to pronounce. These are particular bacteria which have anti-inflammatory effects and immunobalancing effects. And stool also contains short-chain fatty acids like butyrate and propionate and acetate that support gastrointestinal health. Those short-chain fatty acids serve, among other beneficial effects, as fuel for the intestinal lining, which is optimal to maintain the intestinal environment and keeping it separate from the rest of the body. The stool also contains bile acids and various bile salts that help regulate metabolism and digestion. And there are antimicrobial compounds that help to defeat and push out negative bacteria or pathogenic bacteria. The stool also contains a variety of metabolites and signaling molecules that influence immune function favorably. And these Bacteroidetes and the Firmicutes bacteria also have, as I mentioned, anti-inflammatory properties, but they also help reduce leaky gut and help to regulate the immune system. There are small molecules and proteins that support intestinal barrier function, which I just mentioned, and also prebiotic compounds that help sustain transplanted beneficial bacteria. So these are ingredients that are, most of them are not available in a medication or even a natural supplement. Some of them are. You can get bile acids, for example, and short chain fatty acids and probiotics. But everything else I've mentioned is pretty much unique to the gut. And my guess is that there may be tens of thousands, if not even more, various signaling molecules in the stool that offer beneficial effects. So the stool is unique in this way. So when should a doctor, or for that matter, a patient, consider a fecal transplant or FMT? So a doctor should consider fecal microbiota transplantation for a patient when they have a couple of particularly resistant conditions to standard medical treatment, like Clostridium difficile, which is a particularly resilient type of bacteria that results from the overuse and misuse and even the proper use of antibiotics. And it kills hundreds of thousands of people every year. And this bacteria often does not respond to traditional antibiotic therapy, and that is why FMT is so particularly important for this condition. And it may also be considered for patients with treatment-resistant inflammatory bowel disease, whether it's proctitis or Crohn's disease or other forms of inflammatory bowel disease, such as Crohn's disease. And emerging research suggests that FMT may help patients with even irritable bowel syndrome, chronic constipation, and a variety of antibiotic-resistant infections. So FMT should be performed under medical supervision. Years ago, I had several patients who performed FMT on their own out of a hospital. In fact, it wasn't even acknowledged in medical circles back then. It was just starting to get some attention. And there are, as you'll see in a little bit, there's a complex procedure that's involved in performing this correctly. So patients interested in FMT should consult with a gastroenterologist to determine its suitability for them and discuss any potential benefits. And of course, there are risks. So with home administration, obviously the risks are higher. And medicine strongly discourages people from using FMT in their homes. One of the claims is that it needs to be a sterile technique. I think it needs to be a clean technique, not necessarily a sterile technique. And in terms of the cost of FMT, the cost will vary depending on a variety of factors, such as the healthcare facility and insurance coverage. So it's advisable to consult with healthcare providers and your insurance company to obtain specific cost information. So what are some of the pre-procedure, pre-FMT testing and evaluations that should be performed to properly do this procedure? So a comprehensive digestive stool analysis, which will quantify the balance or imbalance of good and bad bacteria and fungi and other aspects of the gastrointestinal tract. An HIV and hepatitis panel should be performed to make sure that the person who's donating the stool has no viral infections that they can pass on. And a complete blood count, which includes liver function tests to screen for inflammatory markers and overall liver health. And then there's what's known as a multi-complex PCR panel, which identifies various pathogenic organisms that might be in the donor stool, which means you must find another donor. And then there is a metabolic panel, which assesses overall organ function and electrolyte balance before FMT procedure. And in a hospital setting, this is the basic procedure. In terms of donor screening, a healthy stool donor is selected based on medical history, the absence of infections, and recent antibiotic use. The pre-procedure labs, I've just mentioned some of them. The donor and recipient must both undergo tests for pathogens, including C. difficile, parasites, HIV, hepatitis through stool cultures. And then the patient stool collection and preparation involves collecting the stool, mixing it with saline or other solutions, and filtered to create a liquid suspension. The recipient may undergo bowel preparation like colonoscopy prep or fasting before the procedure to get the colon as clean as possible. And in terms of FMT administration, the fecal transplant is introduced via colonoscopy or a nasogastric tube, sometimes an enema or capsules, depending on the clinical indication. In terms of monitoring and reactions, the patient is observed for any immediate adverse reactions such as bloating, cramping, or fever. And the post-procedure recovery consists of patients being advised on dietary and probiotic supports to help establish healthy gut microbiome. And then there's follow-up testing, stool tests and clinical evaluations that are performed to assess symptom improvement and any microbiome changes. And again, on my website at drmichaelwald.com, you'll find greater detail on the actual tests for the donor and the recipient. I should mention that those tests may vary from hospital to hospital or medical institution. But there will be certain commonalities, of course. So what about artificial stool for FMT? There is at least one manufacturer of artificial stool which has no actual stool in it. My feeling about that is it may actually be of some benefit, but I do not think it will have the potential of actual stool. Because stool is what the body makes. And again, there's just too much complex reactions going on to recreate those in a lab, but I could be wrong, and it's something that we should continue to be open-minded about. But research is ongoing into the development of artificial stool products, often referred to as capsules. That's a very original name, which aim to provide the benefits of FMT without using donor feces. So that is in the works, and I believe a few patients might have actually received that. So these products are still under investigation, so their availability is most likely limited. But these capsules are capsules containing freeze-dried or processed fecal microbiota intended for fecal transplantation. They're designed to deliver healthy gut bacteria from screen donors to individuals with gut microbiome imbalances, such as those suffering from life-threatening C. difficile infections, irritable bowel syndrome, and various inflammatory bowel diseases. The capsules are provide a non-invasive alternative to the traditional FMT, which I described earlier, which may be administered through a nasal gastric tube or through colonoscopy procedure. These are some of the conditions. I've mentioned them a couple of times, but I'm going to go over them again because they're important. C. difficile infection is, FMT is primarily used to treat this these days, particularly if the C. difficile does not respond to antibiotics. I would think that they first should go to the stool, then to the antibiotics, given the fact that C. difficile was caused by antibiotic resistance in the first place. And then there's inflammatory bowel disease, because emerging research is suggesting the potential benefits of FMT for conditions like ulcerative colitis, Crohn's disease, and studies are ongoing. I mentioned irritable bowel syndrome, and those with antibiotic resistance may benefit from FMT. I had a client years ago who was dying in a hospital, and they basically wrote her off. She was very close to death. And the mother of the female patient donated her own stool on her own outside of the hospital. And the patient had a persistent C. difficile infection, which is a miserable condition, which is characterized by constant diarrhea, which usually kills the patient. After the FMT therapy, she was cured of that condition. And there are other conditions such as autoimmune diseases, which may respond beneficially to FMT, because autoimmune diseases, for the most part, also involve imbalances in the gut. For chronic constipation, FMT has demonstrated very nice efficacy in increasing bowel movements and improving symptoms in patients with slow transit constipation. And I mentioned here again some of the pre and post procedure. I won't go over it, but this is a shorter summary than the one that I just reviewed a few slides ago. Now, in addition to this therapy, there are some synergistic nutrients that might be considered that could increase the chances of FMT working. Those would include prebiotics, which are non-digestible fibers that promote the growth of healthy bacteria. And you can find them in garlic, onions, bananas, asparagus, and also in supplements. And then there are probiotics, which are live bacteria that help maintain gut health. The right type of yogurt and kefir, sauerkraut, and probiotic supplements would be sources of those probiotics. And then there's glutamine, which is an amino acid that supports intestinal lining integrity. In fact, glutamine is the most abundant amino acid in the body and the most important, in many cases, for intestinal cell replication. And then there is zinc, a mineral important for immune function and gut health. Those are just some of the nutrients that I consider for a person who decides to get FMT, but testing would reveal what other nutritional issues that the patient might have, and those should be corrected, even if they have nothing to do with those several nutrients I just mentioned, the prebiotics, the probiotics, the zinc, for example. Because if you don't fix underlying basic needs, other nutrients which are supposed to target some areas may not work as well. So it is essential to consult with a healthcare provider before starting any new supplements or making any significant dietary changes, especially when undergoing treatments like FMT. So that'll pretty much conclude this presentation. I hope it was useful. Once again, my website is drmichaelwald.com, where you can find more information on this, and you can email me your comments and questions at info@blooddetective.com. Thank you so much for joining me, and I'll see you at the next podcast.